Have you ever wondered about the cause of typhoid fever and how it can be prevented? Today we delve into the intriguing world of this infectious disease. Typhoid fever is an acute infectious disease caused by the bacteria Salmonella typhi. It is commonly found in areas with poor sanitation, especially in developing countries. The disease is transmitted through the digestive system, often through contaminated food or water. The root cause of typhoid fever is the Salmonella typhi bacteria, part of the Enterobacteriaceae family. Interestingly, its only natural host is humans. Symptoms of typhoid fever can vary. A high fever, often above 38 degrees Celsius, lasting 3 to 5 days, is a common sign. A skin rash usually appears 1 to 2 days after the onset of fever, beginning on the face before spreading to the neck, chest, back, and limbs. This rash often starts red and flat, eventually developing into small blister-like bumps filled with fluid. These bumps can be itchy and may burst after 1 to 2 days, leaving behind scales. Digestive disorders such as diarrhea, constipation, abdominal pain, nausea, and vomiting may also occur. Other symptoms can include fatigue, headache, high fever, chills, muscle pain, cough, and runny nose. Diagnosing typhoid fever involves a clinical examination where the doctor will ask about your medical history and symptoms. Blood tests can help identify if you have been infected with Salmonella typhi bacteria. Stool tests can also determine if you have the bacteria in your feces. When it comes to treatment, antibiotics are the main method. Commonly used antibiotics include amoxicillin, chloramphenicol, and ceftriaxone. Supportive treatments include drinking plenty of filtered water, fruit juices, or soup to replace fluids and electrolytes. Fever reducers like paracetamol or ibuprofen can be used if high fever occurs. Some measures to reduce itching include applying cool compresses to the skin, wearing loose, cool clothing, and avoiding scratching the blister-like bumps, as this can lead to infection. Preventing complications is crucial, as typhoid fever can lead to dangerous complications such as pneumonia, hepatitis, and gastrointestinal bleeding. Hence, patients need close monitoring to detect and treat any complications promptly. To prevent typhoid fever, personal hygiene is key. Regular hand washing with soap and water, especially after using the restroom and before eating, is essential. It's also important to consume safe food and water. Only drink safe water that has been boiled or filtered, and avoid water from unknown sources. Avoid direct contact with people who have typhoid fever. Remember, typhoid fever is a dangerous infectious disease that can be fatal if not treated promptly. If you experience any symptoms of typhoid fever, seek medical attention immediately. Adhering to preventive measures can help avoid the disease. In summary, typhoid fever, caused by the bacteria Salmonella typhi, is an infectious disease transmitted through contaminated food or water. Symptoms can vary from high fever and rash to digestive disorders. Diagnosis involves clinical examination and blood and stool tests. Treatment includes antibiotics and supportive measures. Prevention involves maintaining personal hygiene, consuming safe food and water, and avoiding contact with infected individuals.